Hello, in this video we are going to the doctor and learning some hospital-related vocabulary. Jane woke up feeling sick, so she decided not to go to work but call the doctor's office and make an appointment with a doctor. Before going to the doctor, or visiting the doctor, or going to see the doctor, you must make an appointment with the doctor, usually on the phone. In case of emergency or a serious situation, you can call an ambulance, and we say he or she was taken to hospital by ambulance or rushed to hospital by ambulance. So Jane came to the doctor's office. Let's listen to their conversation. Hello, what's the matter? I don't know, I feel sick and I've lost appetite. Well, I need to examine you. Probably the first specialist you need to see when you have a health problem is a general practitioner, or in the USA this doctor is called a physician. So what does a general practitioner or GP do? He or she makes house calls, which means visiting patients at home, which happens very seldom because this is quite an expensive service. Provides ongoing medical care, provides routine health screening or examination, counsels or advises on physical condition and lifestyle. The doctor will ask you to describe what you feel or your physical condition. We've already learned some phrases in my previous video, let's look at them again. I feel unwell. I feel sick. I keep vomiting. I can't sleep. It's painful to swallow. Now let's look at the phrases that the doctor says. I will examine you. I will press on your stomach. Does it hurt here? I will write a prescription. To identify the cause of your problem, the doctor or a nurse takes your blood pressure, takes your temperature, takes your pulse, or takes your blood sample for tests. The doctor or a nurse may give you an injection. It is only the doctor then who can give you a prescription, which means to make a list of medicines that a patient should take. And the doctor gives a patient a checkup, which means examining the patient to control his or her condition. The doctor prescribes medicines or medicines. In the USA they are called drugs or medications, such as pills, for example sleeping pills or pills for the stomach. We use the preposition for to show what exactly the medicines are aimed to treat. It can also be a mixture or a liquid medicine, or in the form of drops, for example eye, nose or ear drops. So how about Jane? She was diagnosed with gastritis and the doctor prescribed some medicine for her stomach. Mike was in a hurry. He was going to meet up with his friends. He was running down the street when suddenly he fell down and hurt his leg. The injury was so bad that he couldn't stand up. An ambulance was called and it arrived to help Mike. A healthcare professional who works on an ambulance is called a paramedic. Mike was put on stretches and taken to hospital. When a person arrives at a hospital and becomes a patient, he or she is first admitted to hospital, or in the American English we say admitted to the hospital. There are different hospital departments, for example, an emergency department or a casualty department, which provides medical treatment and the acute care of patients who are admitted without prior appointment, often taken to hospital by an ambulance. An intensive care department provides treatment for people who are very ill, often in a critical condition. A ward is a separate room in a hospital typically for a certain type of patients. An operating theatre is a place where operations are performed. It is called this way because many years ago people actually came there to watch operations, as in the theatre. A maternity ward is a special ward for the treatment and care of women and babies during pregnancy and childbirth. An outpatients department is the part of a hospital designed for the treatment of outpatients, people with health problems who visit the hospital for diagnosis or treatment but do not stay at hospital for a longer period. So what are medical procedures performed in hospital? They do an X-ray, put a plaster cast on or around a hand or an arm, or put an arm in a sling. Healthcare specialists can also put stitches in a wound, put a bandage on a hand or on an arm, give you an anaesthetic. A surgeon is a doctor who performs surgical operations. You can say perform an operation with the indefinite article an, or in the plural, perform operations. The word surgery has the same meaning, but we do not use the indefinite article when we mean one operation. We say perform surgery with no article. Or you can also use the word surgery in the plural, so you can say perform surgeries, but please do not use the indefinite article with the word surgery. However, sometimes you can say a surgery, but only in the meaning of an operating room or an operating theatre. We can say perform or carry out surgery or an operation, but we cannot say make or do surgery or make or do an operation. This is not very, English. And when the treatment is over, a person is discharged from hospital, which means he or she leaves hospital. So this is all I wanted to share with you on the topic. I hope you like this video and please subscribe to my channel.